in Europe.
Welcome, everyone. I'm Steffi Rapp from the Office of Juvenile Justice and Delinquency Prevention. I want to thank you for joining our discussion today, how communities can connect with the National Dialogue on Mental Health. OJJDP supports the integration and collaboration of mental health and juvenile justice services to better serve our youth. We will be hearing from dynamic speakers in the field who have been doing this work. I will now turn it over to my colleague from SAMHSA, Wendy Vilos, to introduce our panelists and this initiative.
Good afternoon, everyone, and welcome to today's webinar, Creating Community Solutions, How to Connect to the National Discussion on Mental Health. My name is Wendy Vilos, and I'm with the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. We are very excited to share information about the National Dialogue on Mental Health that we launched and have maintained with the help of many partners, including today's presenters. As the first-year anniversary of the Sandy Hook tragedy is upon us, we are reminded that all too often we hear in the news reports about these tragic events and why mental health is important to every person and every community. We know that around 1 in 5 young people have mental, emotional, or behavioral disorders at any given time. We know that treating these disorders is expensive, with an estimated $247 billion in annual costs. We know that the financial impact is felt in multiple sectors, including education, justice, healthcare, and welfare. We know that above and beyond the fiscal impact, these disorders affect not only the individual, but their families and communities as well. Mental health professionals are an essential partner at the table with juvenile justice and education, so SAMHSA is very happy to present this webinar in partnership with OJJDP. Today's panelists represent several of our partners who are working together to change the way the nation talks about mental health issues. Our panelists are Dr. Carolyn Lukensmeyer, Executive Director of the National Institute for Civil Discourse and founder of America Speaks, Elaine Abele-Mateo, Consultant from Everyday Impact Consulting, and Tom Campbell, Senior Associate with America Speaks. Now let's hear from OJJDP National Training and Technical Assistance Center from Michelle Duarte-Tom.
Good afternoon, everyone, and thanks so much for joining us today. As your host, I would like to take just a few minutes to discuss a few features of Adobe Connect, which will help you maximize your opportunity to participate in today's webinar. To view the bios and photos of the presentation panel, please access the documents which are available now in the handout pod of the webinar dashboard. There are 11 additional documents that will be referenced today, but at this time you are able to access them and download them and save them wherever you'd like. To send a chat message to me, your host, a panelist, or another attendee, click 1 on the menu icon in the upper right corner of the chat pod, choose Start Chat With, then select Hosts, Presenters, or specific attendees. 2, type your message into the text box, and 3, hit Enter or click the message bubble icon to send. For those of you participating in today's webinar as a group, thank you. Please take a minute and help us count. Go to the chat window and type in the name of the person registered and the total number of additional people in the room with you today. This will help us with our final count. Again, if you are viewing with a larger group, please type in the name of the person registered and the number of additional people joining you today. There will be several opportunities for Q&A throughout the webinar today, so get your questions queued up. Questions will be answered as time permits during the Q&A segments. Additionally, there will be 3 poll questions. Please take the opportunity when the poll questions are available to provide us feedback. And then finally, at the conclusion of today's webinar, you will be provided with a link to take a 5-minute online survey about today's presentation. We appreciate your feedback regarding this web event. This information is used to assist in future planning and training. You will be able to access the evaluation link on the last slide of the PowerPoint. For those of you participating as a group, when you return to your office, please enter the link on the last slide in your web browser to share your feedback. And finally, this event will be archived in OJJDP's Training Center at www.ntac.org in approximately 10 business days. Again, thank you for joining us today. Ms. Velos?
Okay, welcome once again to Creating
Wendy Vilos from the Center for Mental Health Services in SAMHSA, where my portfolio includes serving as the staff lead on the National Dialogue on Mental Health. Today we'll discuss more about how this national discussion on mental health got started and how you can leverage your existing partnerships to address the mental health needs presented in your community. We hope that through this webinar, more partners representing juvenile justice and education will join us in creating opportunities to discuss mental health issues openly. We will also identify resources that can help you take next steps using lessons learned from communities leading this charge across the nation. First, let's talk about what is the National Dialogue on Mental Health and how did it get started. Following the tragedies in Newtown, Connecticut on December 14, 2012, President Obama called for a national discussion about mental health issues with a particular focus on youth. On June 3, 2013, the White House held the National Conference on Mental Health, bringing together cabinet-level officials, members of Congress, mental health professionals, advocates, celebrities, young adult leaders, and of course, people with lived experience. This conference was the first mental health conference hosted by the White House since 1999, and it focused on actions we can all take together to increase understanding and awareness about mental health. Well before the national conference, SAMHSA and other federal agencies reached out to allies who we knew could help get this conversation started. Our next presenter, Dr. Carolyn Lukensmeyer, will talk more about the partnerships that have been forged and how they began. On behalf of SAMHSA, I would like to briefly acknowledge all of the partner organizations who have helped us come as far as we have to share these accomplishments with you in such a short amount of time. Their efforts are amazing and inspire us all to continue to work hard to keep this ongoing conversation alive. Although we had few monetary resources to offer to support the National Dialogue on Mental Health, the Department of Health and Human Services committed to developing other types of resources to help individuals, communities, and organizations to discuss mental health issues openly. The department launched a new website called mentalhealth.gov with resources focused on how to talk about mental health problems and how to access help. In July, SAMHSA released the Toolkit for Community Conversations about Mental Health, which includes an information brief, a discussion guide, and a planning guide. The toolkit was developed to help individuals, communities, and organizations discuss mental health issues using a structured format and with a common set of facts and information. However, through orders for the toolkit, we have learned that these materials are also being used for wider audiences, including state and county planning efforts, and in a variety of settings for training and to build staff competency. These guides are available for download in the handouts pod of the webinar dashboard. They can also be downloaded on the SAMHSA website listed on this slide. Very soon, we will release the entire toolkit adapted in Spanish, along with an infographic called Mental Health in My Community. The infographic will be available in various sizes to share on social media, to print, and as a printed high-resolution poster to share at events. All of these materials can also be ordered in bulk quantity as nicely printed booklets from the SAMHSA store. We have also increased our social media engagement and coordination with our partners to share information about mental health online. You can follow mentalhealth.gov, samhsa.gov, and Creating Community Solutions online. You can share your work through using the hashtag we have developed for the National Dialogue on Mental Health, hashtag Mental Health Matters, all one word. As a reminder, please take a look at the handouts pod where we've uploaded a number of other resources that you can explore throughout the webinar. And now I'll turn it over to our first presenter, Dr. Carolyn Lukensmeyer, Executive Director of the National Institute for Civil Discourse.
Thank you very much, Wendy. I'm delighted to be with you all today. The 7 organizations that are running Creating Community Solutions, the National Institute for Civil Discourse, America Speaks, Everyday Democracy, the National Issues Forum, the Kettering Foundation, the Deliberative Democracy Consortium, and the National Coalition of Deliberation and Dialogue, said an immediate yes when Stephanie asked us to join this call, because we know how closely linked issues of juvenile justice and issues of mental health among young people are. Many of the communities we've been working in tell us that far too many of their young people are now in juvenile holding, whether it turns out to be a jail or a training program, because mainly of a mental health issue. So we know how important this link is, and we hope that by our time with you today that you will see from I think we have almost all states represented on this call, that you may see a way to add a community conversation to a program that you are already doing in your community. But the Oh, just one second. I have to get back on track about changing the slide. There are two goals to what Creating Community Solutions is doing. In every community we've worked, we continue to hear that the misperceptions and the mythologies about mental health, and frankly what people say is the stigma, is the major reason that young people often do not come forward to self-identify and actually get help early. So we're doing a lot of education to break down the misperceptions and to educate about what it means to really support young people and their families in recovery and to have a healthier community. The second goal, equally important as the first, is it's not enough to talk about this issue in the world we're living in today. We have to figure out ways to take meaningful action. So every community, when you go to the Creating Community Solutions website, every community that's participating, you'll see, is identifying what a collective group of people in that community, often aided by organizations, will come forward and say, this is a set of actions we are going to take to improve this situation for our young people. When we conceived of this strategy with SAMHSA and HHS, there were three parts to it, one of which is online dialogues, which I'm not going to talk about at all today, but you can find it on our website. But critically, we identified what we called 10 lead cities, one of each in the major regions that match HHS and SAMHSA's administrative and service structure across the country. The criteria to be a lead city is the mayor in that community had to convene the public to come together. They created a diverse organizing team that was led either by America Speaks or Everyday Democracy or the National Issues Forum. The agreement was it would be large scale, at least 300, sometimes 400 people. And here's the tough part, and all you who work in communities will know how hard this is to do. The agreement was that those 300 to 400 people would be demographically representative of the population of that metropolitan area, with an agreement to oversample for young people. Hats off to Washington, D.C. and Sacramento, you'll hear from later. In both of those cities, a full 33% of the 400 people who were in the room were between the ages of 14 and 24. And I know all of you on this webinar know what it takes to pull that off. Every single one of the lead cities created a steering committee of organizations, and you're going to hear detail about this from Sacramento, about how to turn the public's priorities into an action plan for a commitment to implementation over the next 2 to 5 years. Equally important with this strategy is what an academic would call distributed conversations. But the idea here was everybody in the United States should be able to do this. They should be able to download the materials that SAMHSA created. They should be able to get coaching from the team that works with CCS. And all that has to happen is they go on the website, they put a pin in a map of the United States. Let's say I'm in El Paso, Texas, or I'm in Milo, Maine. I put a pin in, our community organizer, Sue McCormick, gives you a call and helps you set up, whether you want to do 10 people in a Rotary Club, you want to do 100 people in a high school, or for the people on this call, you want to add just an hour to a program you already have designed and organized to ask a couple of critical questions about mental health that could be outcomes that get added to CCS, which SAMHSA and HHS are paying attention to the themes that come from communities all over the country. So our biggest hope out of our time with you today is that you'll find a way that's very easy for you. We've put all the infrastructure in to make it easy. You have created the context in your own community in which we might make the connection. If we put those two things together, you're a step forward in terms of linking mental health and juvenile justice. We're a step forward in having a larger number of communities involved and a larger sample of outcomes for SAMHSA's policy and resource work in the future. We have organized all of these conversations around 4 questions. And let's say you add 1 hour to some program you're doing. Our request would be you just take one of these questions, or maybe 2 at the most, and have a dialogue about that, which you could then tell us the outcomes. But here's the 4 questions. Because of how sensitive people are about these issues, we believe it's important to talk, what does mental health mean to me? And what's the sort of ethos in our community about mental health? So that's where we usually start our conversation. Next, we look at what are the key factors and challenges that influence mental health in our community. I know you'll hear more about this from Sacramento. Sacramento County has one of the most diverse populations in the whole United States. Very, very broad immigration from many different parts of the world. So one of their biggest challenges, they've got some great services, but how do the newcomers from Somalia or Sudan even know how to get access to those services? Critical question to start to move to action. What can we do to support the mental health needs in our community, particularly of our youth? And then finally, we talk about what action steps could we take to improve the status of young people's health. I'm going to hand this back to Wendy, who's actually going to ask a poll question that will give us some sense of the interest you have in this kind of work.
Okay. Thank you, Carolyn, for giving us a brief update about what is going on with creating community solutions. We're going to take our first poll question. So the first poll question is, how important is the issue of mental health to your work in your program? Is it 1, extremely important, 2, very important, 3, somewhat important, or 4, not important at all? So we'll take just a second to look at everyone's responses, engage a little bit about where everybody is sitting. It looks like extremely important seems to be the most popular, followed by very important. So the topic seems to be very relevant for our audience, and we're very glad that you joined us for this webinar, given that mental health is very crucial to what you seem to be doing. Okay, so we have about 64% that said it's extremely important, and about 27% said very important. So we're glad to hear that, and we hope you'll learn about a lot of resources during this webinar.
Okay, thanks, Wendy. I'm going to do a bit more detail about the lead cities, which again, you can go on to the website www.creatingcommunitysolutions.org and look at for as much detail as you want. But the public engagement part has now been completed in Sacramento, California, Albuquerque, New Mexico, the District of Columbia, and the metropolitan area of Kansas City, covering both Missouri and Kansas. Birmingham, Alabama, the mayor and his team made a decision to extend these discussions over a longer period of time. So about half of the dialogues will be done by the end of this year, and about half of them will be done in the first 3 months of next year. Now, I realize I didn't update this slide, but Columbus, Ohio is now actually operating as a lead city. Mayor Coleman has signed on. They have already done significant work in the county as a whole and in neighborhoods. I saw that some of you are from Ohio through the registration. If you would like to get involved in the ongoing work now in Columbus, Ohio, the person to contact is Fran Frazier. Her email address is womensworkfcf@gmail.com. And again, you can click on Columbus, Ohio on the map, and it will also give you the link to Fran or give you the link to NAMI, the National Association for the Mentally Ill. The other 3 states that will end up being lead cities, we believe, and I'm going to spend a minute or two about Colorado because we have a very unique opportunity in Colorado. We've developed a strong partnership with the public television station and with the NBC affiliate in Denver, Colorado, who have committed to producing an hour-long television show to describe the work that's being done in a variety of communities around Colorado. We know for sure that Colorado Springs, Fort Collins, Pueblo, Denver, and I think I'm missing at least Grand Junction, are definitely going to hold dialogues. And here again, you can do it whatever size you want. You could link it to a juvenile justice program. But if you would like to get engaged in this, we would love to have you. And the best way to do that is to contact Sue McCormick, who is our community organizer and who is creating the connections in Colorado. In the Northwest, we do think there will end up being a pretty significant event in the state of Washington, probably Seattle. Later in this call, you'll be hearing from Tom Campbell, the work that he did in Sacramento for America Speaks. So if you are in Washington and you would really like to be early on involved, just shoot Tom an email at tcampbell@americaspeaks.org. Now I want to talk with you about how excited we are about how Americans all over this country, sometimes it's an individual, sometimes it's a library, sometimes it's a NAMI group, sometimes it's a school, already 66 dialogues organized because people are just stepping up and taking responsibility have happened. 11 upcoming events are already scheduled, and 47 events are in the process of being organized but have not yet selected their date. So we, to date, have events that have occurred, dialogues is a much better word than event, that have occurred in 33 states plus DC. We knew it was ambitious when we started, but we'd really like to have a dialogue in all 50 states. Our hope was actually to have achieved that by the anniversary of Shady Brook. So if you know that you're, Sandy Brook. So if you know that you're in a state that has not done this yet and you have a juvenile justice event happening between now and December 14th, we would be deeply grateful if you added an hour to that event. We're now in the process of getting the outcomes from the 66 dialogues that have already happened uploaded, where you could look and see how many people are picking something about putting more counselors in schools, how many cities are picking something about a better triage system between providers and hospitals and families. So you can actually look at the outcomes that people are currently choosing to take action on. I'm going to give you, stories are always the best. Oops, I went 2 slides. Just some examples. West Bend, Wisconsin, part of the YMCA's Healthy Living Service. They co-sponsored with NAMI Washington County and the Department of Human Services a series of 5 one-hour community conversations. New York City focused directly on African Americans, and in the New York Society for Ethical Culture, Black psychiatrists and other partners created a 2-hour event, and their action is to forge new networks that allow African American families and people with issues to be linked to services more quickly. A series of town halls for just millennials is culminating next April in a 25th conference in Palm Beach, Florida, to inform local and statewide legislative policy change for individuals living with mental and substance abuse disorders who interact with the legal system. It's called OK to Talk. Palm Beach County speaks about mental illness and the legal system. They're going to bring a lot of judges into the room to increase their understanding of what the community sees their needs to be. A few more examples. Boston, Massachusetts held an all-day event, The Many Faces of Mental Health, sharing our stories. The Department of Mental Health is running that, and they plan to repeat it in many other locations. So anyone on the phone that lives in Massachusetts, just contact the Department of Mental Health directly. A 2-hour conversation as part of Mental Illness Awareness Week was held at the Alexandria, Virginia Library, and the local mental health agencies all came as support and partners in the meeting. The last example I'll give you was a day-long dialogue in Florence, South Carolina. Clemson University partnered with local mental health agencies, to be followed by additional events collaborating to put the outcomes of all of those events into an implementation plan for action. We are thrilled with the way people are stepping up to this. You know, Pam Hyde and Kathleen Sebelius, when this horrible tragedy happened, they're who spoke up and said, don't do a commission. Don't make this about the policy people or academics again. Take this out to the American public. And as you can see, the American public has responded profoundly. The slide here just shows you the map. You can see we need some help in those vast western states that are lower population, much more rural, often not quite as well organized in terms of the 501c3 structure to support social service kind of work. Okay, I will just do one more slide that talks about, there's the website. Go there to find the locations, the partners, to compare outcomes, get ideas, add outcomes. Actually, you'll find support for creating the new community conversation, whatever level you want to do it, a small group in your home, an organization, or a community-wide level. You'll also find examples there about how to engage online and lots of strategies for communicating through social media. More than 2,000 people have participated already. The website resources, in part I'm repeating what Wendy said. It gives you the information on upcoming and past events. You can download the SAMHSA toolkit there. We also knew that many of you will never use the amount of background material that we created. So we gave you a quick start guide. It's literally a how-to start to finish. It's 3 pages long, and it's designed for a 2.5-hour discussion, but you could easily adapt it to make it 2 hours, an hour and a half, whatever you need it to be. There are webinars there in which we've done training for people who want to hold these dialogues. If you had enough of a link across several of your programs in a state, we do a webinar specifically for you if you want it. You'll also see all the outcomes, and as I mentioned already, lots of social media resources. Now, the last thing I want to talk to you about is going to happen the day after tomorrow. And if you do nothing else action-wise as a result of this webinar, we hope that you will at least use your list to push this out as broadly as you possibly can. It is a fact that what we are trying has never been done before in the United States. We all know that young people now are using their cell phones or their smartphones to communicate more often than any other mode of communication, and it's usually done by texting. So we are creating an initiative. We have created an initiative called Text, Talk, and Act. We piloted it in the high school. We piloted it in the college. And young people said to us that not only did they learn more about mental health than they expected to, but it created a higher level of trust in their classroom. All of you who work with youth know that part of the dilemma that is happening in this country is the broken fabric of trust on every level. In terms of trust in our institutions, trust in each other, and if participating in a short process through texting and talking about mental health is an avenue to increasing trust in a peer group of young people, that is worth gold. It is so easy to do. You start by texting in 89800. We connect you to talk in groups of 4 or 5 people about the issues that are presented, and that group of 4 or 5 people take a decision about what kind of action they want to pursue. We're very excited about this. We hope it actually becomes a tool and a process that schools use to work with their students all the time. So particularly, I know lots of you are on the phone that work in school systems. In the Q&A, if we can answer any more questions about this, we would be delighted to do that.
Now back to me. Okay, great. Thank you, Carolyn, for so much information in such a short amount of time. And as you can hear, Carolyn is very, very passionate about this topic. So we will do all we can to get answers to your questions you've already posed. I know we have several questions that have already queued up from the chat box. If anybody else would like to submit additional questions in the chat box, feel free to do so. We will try to answer as many of these as possible before we move on to the next segment where we talk more in depth about Sacramento. So the first question that we wanted to answer, which we believe, Carolyn, you already did answer this, but just to clarify again, what are we considering the lead cities, the 10 cities, and how do we find a list of those lead cities?
Excellent question. You'll find the lead cities listed on the CCS website. The thing that made them unique was the mayor and the community convened them. The commitment was for it to be a large-scale event where the participants were demographically representative of that entire community, and they committed to raise at least $100,000 for implementation for a minimum of a 2-year period of time. I know you'll hear from Sacramento that they've already raised more money and extended that length of time. But just to repeat, the lead cities that have already been accomplished, the public engagement part, are Sacramento, Albuquerque, Washington, D.C., Metropolitan Kansas City, and Columbus, Ohio. Still upcoming, we believe that Connecticut is likely to become a statewide process, Colorado is likely to become a statewide process, and we think most likely the city in the Northwest will be Seattle.
Okay, and while you're talking a little bit about regional aspects of where the cities are, we had one question that just wanted to know more about how we selected the different cities and what's going on in the different regions. So let's go back a few slides to the map just to answer that question as well as another question.
I think it's probably not surprising to people that the western United States has been slower to respond to this than the Midwest and the East. Part of that is all of you who come out of the culture of both the Plains states and the real West know that the ethos about individual strength and taking care of everything yourself, or at most keeping in the family, is actually a stronger ethos in that part of the country than in much of the rest of the country. So we do encourage people to actually help us on this call to increase the number of pins in the western United States. You see Minnesota looks like it just kind of exploded. That happened because NAMI, the National Alliance for Mentally Ill, decided to push this out and have their chapters all over the state actually hold a conversation. But we're delighted and thrilled at how far this has gone, how wide this has gone, and how impressive the outcomes that are coming in are.
Okay, great. Thank you so much. And I know we had one question about how to get a list of attendees for this webinar and possibly connecting to other partners in your region. And so I just wanted Carolyn to address really quickly how Creating Community Solutions brings together partners and what kind of resources you might offer to folks looking to connect with other partners in their area.
That's a great question, and this is a question we often get on the website. It may be an individual who puts a pin up and says, I'd like to do this in my community, but I can't do it by myself. Colorado Springs comes to mind. The NAMI group in Colorado Springs put in a pin. A woman who's done a tremendous amount of facilitation of dialogues put in a pin. So we actually, our community organizer, connected those two people, had a telephone conference call, and together they identified 4 or 5 more partners. So that is a role we want to play. You'll also know, as I mentioned before, there's a series of webinars that are logged on to the website that will talk to you about how to do outreach. They'll talk to you about how to pull together a coalition of organizations committed to implementation. And frankly, we'd be happy to do a webinar to suit the Office of Juvenile Justice in a given geographic location if that became important.
Okay, great. And if we could go back to the slide really quickly on the map, I had another question about what do the pins mean in the map and the color coding. So I just wanted, Carolyn, if you could briefly explain on this map, there are 3 colors, kind of a teal color, a red color, and a yellow color. And what do they all mean? And how can folks interact with other people who may be represented, their community may be represented by a group or an organization who already held an event?
Okay, so I'm hoping that I get this right. I haven't looked at it myself for a bit, but I'm sure that Mary will correct me if I'm wrong. I'm quite sure what you'll find is that the green pins are pins that are interested, but have not yet held their dialogue. They are still either looking for additional partners or trying to identify a date. The yellow pins are those that they are done. They have held their public process, and about half of them have their outcomes uploaded, and our team is working to get the outcomes of the other half uploaded. The red pins are committed to it, and they have a date. So if you popped on a red pin, the one that you see there in Mississippi, you would in fact find there who the local organizer is and what the date of the event is. And there'll be a place just to click. I should have said this to the earlier question. If you go on that red pin, which I believe is in Jackson, Mississippi, it'll have the name of the person who's the organizer, the date of the event, and right there is a link. If you click on it, it will give you the contact information of how to get in touch with it. It emails them directly, and either you can follow up with them or they will contact back to you.
Yep, and as you explained, some of the information from these communities is listed directly on the websites related to their pins. So if you click on the pin, you might also get some information about what took place in the event, and you can also look for outcomes. If you click the Outcomes button on the Creating Community Solutions website, you'll be able to see the outcomes from the communities who have already connected and had their event. So all of this information is on creatingcommunitysolutions.org, as we've been listing in the chat box in case you missed that. You can also find this information in the Outcomes section and in the Dialogue section. So if you're looking for more people to reach in your communities, there are a lot of partners like the National Alliance on Mental Illness, Mental Health America, and other national organizations who have helped us reach out in these communities. You can engage those partners if you're interested in your community holding a dialogue.
Just one other thing. On the resources page, let's say you're right at the beginning and you just want some help thinking this through. On the resources page, If you click on Contact Us, that will send an email directly to Sue McCormick, who is our full-time grassroots organizer, and she will be back in touch with you. She's amazing. I have no idea how she keeps up with this as quickly as she does. But if you're really at start point and want to just talk it through a little bit about how you and your organization might get involved, I'd recommend going to the resources page, Contact Us, and click on Sue McCormick.
Yep, and Sue McCormick is fantastic. She will definitely help you in any way she can, and she'll keep all of us informed about what you're doing. So one question I did want to address was asked if we could give examples of partnerships with criminal justice partners. I know Sacramento will include that in their portion of the webinar presentation, but Carolyn, did you have any other thoughts about any examples in that area?
I did talk about the one in Palm Beach County. That definitely has a juvenile justice link. It turns out that the Columbus, Ohio one, they had done a tremendous amount of work earlier, once with SAMHSA on mental health first aid. And I don't know, Stephanie, if it was your program in the Justice Department, but it was a juvenile justice program that had federal money invested in it.
I believe it was COPS. Might have been COPS.
I think it was COPS.
Yep.
So Columbus started out right from the beginning having a very strong link between the juvenile justice piece and the mental health piece. And I know that Fran Frazier would be happy to talk with any of you about that link.
Okay, and I know from my experience in the lead cities that Creating Community Solutions has done a lot of work around making sure that the lead cities have demographically representative participants in the community conversations they've held, addressing any cultural nuances in the communities. But can you tell us a little bit more about what other communities are doing to address cultural nuances?
I think there are two things that are the most important for us to identify. You know, I didn't say much about this at the beginning, but the 7 organizations that are leading this, they all come out of the field of the importance in the United States of the public's voices being heard in policy and resource decisions. So I led America Speaks for a long time. Every project we ever did in a city translated the material sometimes as many as 5 or 8 languages. So one of the cultural sensitivities is making sure that the materials for this work are translated into the languages that are important. Clearly in this context, in terms of federal website, there are 2 languages, English and Spanish. But some of the communities have gone ahead and translated it into other languages, so that could be another question you would ask on the website. Do you have the materials translated into whatever language? The second piece that I would say is that when this work is done, we pay a lot of attention to the facilitation of the conversations. And that, again, is a way that we would provide coaching work in any of the projects that you might want our help, in which we actually provide a unit of cultural sensitivity training to the table facilitators. For example, in some communities that have a high Muslim concentration, of just some of the sensitivities, particularly about the differences between Muslim women and Muslim men in terms of the support they're going to need to speak up in a conversation. So that we actually have someone trained at the table that understands how to go about in a culturally sensitive way, making sure that every voice is heard.
Great, and kind of along the line, sticking with the idea of cities, before we move to a question about Text Talk Act, let's finish up the questions about what's going on in the cities. So one of the questions we had was, where could we find an extensive description of the lead cities besides the mayors involved, and what are the requirements to be a lead city? I think the second part we already answered, but where can they find more information specifically about the lead cities?
The most important thing to do, because they are up to date at this point, is to click on whichever city or several cities you want to look at. The stories are very complete at this point. There's videotape on each of those cities. And in each of those places, I'll just give Washington, D.C. as an example. Once you've looked at the material on the Washington, D.C. site, there would be contact information for Steve Brigham, who was the lead from America Speaks. And it would be easy for you to be in phone or email contact with Steve if you even want to dive deeper. But look first at the outcomes section and each lead city. I think you'll be amazed. The kind of poll questions that Wendy was asking you here, we asked those poll questions in those meetings. All of the data about the how people responded to those poll questions are there. Every table's conversations were themed. The content of those table conversations are there. So there's a tremendous amount of material about what happened in each of the cities. What isn't there yet, but will be coming, and I think, and you'll hear from Sacramento, is each city is committed to actually creating an action plan. Those action plans will also be put up on the website, as will action plans that will be less comprehensive and probably have less number of items in them from every city that's participated. But I think in the end, the most important document will be the action plans for implementation.
Okay, and I think we had a follow-up question to that question that says, are there any differences in participation across the demographics? I assume this means in the different cities holding dialogue.
Well, because the organizations that partnered in each city made a commitment to meet the demographics of the region, I think what I can say is in some cities, who the hardest to reach populations are different, but because the commitment was made, we actually did achieve the full demographic representation very close to statistically significant in each of the cities. But we did a webinar and outreach that I think if you're concerned about a particular population in your community, looking at the webinar and outreach you would find very helpful. Also, very important is this demographic data is all in the outcome reports that I talked about in response to the last question.
Yes, they've done a really good job cataloging who is participating and what demographics they represent, including LGBTQ populations, youth, individuals with lived experience, and individuals who have lived experience as family members. So there's a lot of interesting information for those of us who follow mental health really in depth in some of these communities. The last question I wanted to get to, there's one really quick, easy one that I think Carolyn mentioned before, that the resources are available in English and in Spanish. The toolkit for community conversations developed by SAMHSA has been translated and adapted completely in Spanish. All 3 guides and the infographic will be available very soon on samhsa.gov. And so you'll be able to download or even order print copies of the Spanish version. So no need in translating those parts of the toolkit. However, the other resources that are available on creatingcommunitysolutions.org are in English, along with several adaptations that have been done by different communities. So that's a quick answer to that question. And now I want to get to a little bit more specific question about Text Talk Act, which is taking place on December 5th. And so the question, Carolyn, was, I think the first question about Text Talk Act was, do groups need to convene themselves, or will you convene them into groups of 4 or 5? So if you could explain the model a little bit about how folks go through the process to participate in Text Talk Act.
As I mentioned before, we're trying something that's never been tried before. So as people have signed up and registered to actually participate, we've made it clear in the materials and the messaging, which I'm going to interrupt myself. I should have said this before. The Text Talk Act has, the messages are in the handout pod. So that's a good place to go for even more detail after we finish this conversation. But we are actually asking people to be 4 people sitting together in a room. So you're texting independently, but once you have done your texting, then you sit and have a conversation, and a little while into the conversation, we will text you the next question. Then you talk a little bit more, and we text you the next question. And then when you have come to a decision about what you might want to do together, you actually send that information back to us. So we are making a link between it's a small group, it could be with friends, we're doing it in classrooms where maybe the classroom's 25 people and the faculty member has just organized the students into groups of 4. This could be done in a youth development program. This could be done in an after-school program. It's very easy, and frankly, we were just surprised and thrilled at the level of commitment that the students who participated in this in our pilots. It went much deeper, and their sense of having learned new information, because we're also texting out some of the same information that's in the toolkit during the process. So they actually learn something. They have a chance to, I'm going to stop here and say, lots of the kids in the 2 pilots actually shared either their own personal stories about their own lived experience or about a story of someone in their family or a friend. And very often, because we were all listening to this, very often you would hear them say, I've never told anyone this before. And no matter what kind of issue any of us are dealing with, health, mental health, behavioral, the first step is articulating and having the confidence to tell your own story. So it's our hope that of the thousands of people that are going to participate on this the day after tomorrow, that will happen for a lot of young people. If you, again, one other resource besides what you're finding in the hands-on pod, if you go to the TTA page on the Community Solutions website, it has all the information, including a short video, which we were able to take out of the pilot process, which therefore will give you a very, very concrete sense of how this works.
Great. And if there are any other further questions about Text Talk Act, we actually have a gentleman on the Creating Community Solutions team named Matt Leininger, who is very knowledgeable about how this works, and he can answer some of the more technical questions that we received, including this question about the age range of Text Talk Act participants. We do know that school-age youth can participate. So that is kind of a short answer to that, but we will be happy to get anyone in contact with the Creating Community Solutions team planning this event.
Actually, I can answer that one.
Oh, good.
We're doing it starting in middle schools. We're not going any younger than middle schools, and lots of colleges are participating. So we're looking at young people ages 13 to 25, 26, whatever.
And adults too, right?
Yes.
Oh, and adults too. So you could always do this.
But the focus really is on youth.
Yeah, absolutely. And the other question we got really quickly was, is there going to be another Text Talk Act event? And we are still looking at opportunities, and possibly in the spring. So if any of you are interested, please let us know, and we will be happy to keep you in the loop as we plan future Text Talk Act activities. Okay, so now we are going to move into the Sacramento Experience. So this is the second part of our webinar, and we are very fortunate to be joined by two dynamic speakers. First, I'll introduce Elaine Abele-Mateo. She's the consultant from Everyday Impact Consulting, and she'll be presenting along with Tom Campbell from America Speaks. Both of them are representing the team in Sacramento, so they're not the only folks working in Sacramento, and they'll give you the perspective of what's been going on, what have they accomplished, and how are they going to get to the outcomes that they envision for their community. So now I'll turn it over to Elaine and Tom.
Hi, good morning from California. This is Elaine Abele-Mateo. I'm thrilled to share our work here in Sacramento, but more importantly, I really hope to illustrate what the Creating Community Solutions work could look like in your community as you kind of think about if this is something that you could do in your state, in your city. So in Sacramento, we held our Creating Community Solutions Day of Dialogue on July 20th. I had the pleasure of leading the outreach effort and continued by providing staff support in the development of the community action plan alongside Tom Campbell. We had a dynamic showing of over 350 diverse participants from the Sacramento community, and like Carolyn said, over 30% were young people between the ages of 16 to 24. And the day was a 6-hour day in July, and it was very interactive. We themed ideas and voted live, and it was a great opportunity to do both education on the topic of mental health and get community feedback. In Sacramento, we had a strong showing of community leadership who really championed the event and kind of the follow-up steps, the action planning, and now we're moving over to the request for a proposal process. But in Sacramento, we had a strong showing of community leadership. Those leaders included our mayor, we had a state senator, a congresswoman, and various local elected officials. Just a quick note about Sacramento's diversity, which Carolyn noted in her presentation. We are a very, very diverse community. Several years ago, Time magazine, in fact, touted Sacramento as one of the most diverse cities in the nation. And I'm really proud to share that we were able to reach a wonderful representation of that diversity, which I'll discuss a little later in my presentation. So in Sacramento, we're very fortunate to have the support of some really great foundations who provided the resources to host the Day of Dialogue, but to also support the action planning, which Tom will discuss in more detail. So those foundation partners include the Sierra Health Foundation, the California Endowment, the California Wellness Foundation, and Blue Shield of California Foundation. So our action planning process in Sacramento, we were one of the first cities to host our Day of Dialogue through the Creating Community Solutions Initiative. I think Albuquerque actually hosted theirs on the same day. So in many ways, we helped kind of design our own path in terms of process. Following the Day of Dialogue in July, everybody who participated understood that the content that came out of that dialogue, out of that event, would result in the development of the action plan, and that's really key. The action plan would then support a 12 to 18-month implementation period. So after the big event on July 20th, we hosted a series of action planning meetings, which were led by Tom. At the end of last month, we've completed the action plan, which I believe are available for viewing as well. And right now we have a request for proposal. We have an RFP out to support the implementation process. So here's something that's fairly innovative about the Creating Community Solutions approach. The framework is really cross-cutting as it engages multiple sectors and domains. Oh, I don't see them on here. Oh, we're flipping through. Give me 1 second. Let me see what's going on. If I can get the slide up with the domains. But let me just share here. So stakeholders that have participated have included multiple sectors, education being one of them, juvenile justice. I heard the question earlier, and the question about, how are juvenile justice partners being engaged? Sierra Health Foundation, which is one of the funders who's participating along with us, is actually rolling out or has rolled out a positive youth justice initiative. So, they're deeply involved in youth justice work, and obviously they are at the table as a funder of this, initiative here in Sacramento. Obviously, local funders. We had local government, both city and county participate. First responders, law enforcement, mental health and substance abuse practitioners, faith-based organizations, those involved in healthcare, and a myriad of social services, including workforce development, which is really important to the youth demographic, and then youth development services. It's also worth noting that we actively engage young people in the process as well. So, the point here is that when, we talk about the Creating Community Solutions approach, that the framework really casts the net wide. We were very intentional about engaging multiple stakeholders, both in the event, in the action planning, and then as we move towards implementation. So it really becomes this community process. So talking a bit about the community process, we worked really hard to get a broad base of representation at the Day of Dialogue and then following the event. Some of the ways we did that is by reaching out and making personal contact with trusted community leaders. So I know that many of you who are on the call today represent both the juvenile justice and education sector. So I'm sure you know all too well that in order to genuinely engage young people, trust is extremely important, and especially around this topic of mental health, which can be a very sensitive topic to engage them in. So working through the community leaders, their trusted leaders, helped kind of bring them to the table, and what we're finding is it's helping to sustain their participation over time. So diverse participation, considering the diversity of our community in Sacramento, we went to very great lengths to, our approach was really to eliminate any barriers that a community member might have in participating. So in addition to transportation resources, providing food and childcare at the event, we, as Carolyn mentioned, we provided written materials. We have translators available in 5 different languages. And youth participation was very key to the success of the event. And, I don't have to tell you folks who work with young people, getting young people to an event on a Saturday in July for 6 hours. It was not necessarily an easy feat, but we were able to do that because of the way in which we approached engagement of the young people. We ended up enlisting a local youth group, the Sacramento Building Healthy Communities media team, to conduct the youth-to-youth outreach. So we have the young people going out and talking about the importance of other people coming to this event and participating and having their voice heard. They also, kind of drove the outreach process and told us, here are the tools that we need to use. We need to use Twitter. We need to use Facebook. They designed a series of video vignettes that help them describe from the youth voice and the youth perspective, mental health and some of the challenges that they're facing. So the young people really illustrated for themselves why it's important for other young people to be at the table. And then finally, a place for everyone at the decision-making table. As the group moved into the action planning process, working with, we were really intent on making it an inclusive process. If this is going to be about creating solutions, really need to make sure that that the community is involved. So the outreach process, I'll just mention a couple things here. In order to reach a broad cross-section of the community, we really reframe their thoughts, beliefs, and assumptions about mental health. It looks like people may be having trouble here. Okay. So we encourage people to think about mental health beyond the serious illness, to think about stress, think about anger, think about being sad, all as part of mental health. In some communities, in fact, some ethnic communities, this concept of mental health doesn't really exist. So we had to do things like changing the flyer. We asked questions. We didn't talk about, Day of Dialogue mental health event on July 20th. We asked questions like, do you get stressed? Do you feel sad? Do you get angry? To help turn the dial in their understanding of mental health and engage them in the process. We enlisted a broader base, and I think that this is important because as it relates to creating community solutions, it really was a community effort. The recommendations that are within the action plan that Tom will describe a little later were created by a myriad of stakeholders. Again, as part of the design, we were intentional about bringing in multiple domains and sectors, which included traditional mental health service providers who participated and provided input, but they didn't necessarily dominate the discussion. So an example is youth voice. The young people who were at the table were, just as engaged, and their voice was just as equally as strong as mental health practitioners at the table. And when we did the outreach, we impressed upon those that we were reaching out to that that we were really trying to reach a large cross-section and a diverse makeup of the community, which for many people was very intriguing because for some stakeholders, they didn't necessarily feel like they had a place at the table. So being asked to participate in the discussion, to be asked to be part of the solution, kind of turned the dial for them. And then because of the design in our outreach, we were able to reach key community leaders. We asked them to be ambassadors in their community and to their constituencies. What we found is two things. One, people were hungry to be part of this conversation. And so, I can't stress this enough, is that if you're thinking about having this conversation in your community, it is very worthwhile because what we're hearing from folks is that, they haven't been able to engage their communities in discussions like these. And so it was a great opportunity to have that dialogue as a community. The folks that we spoke to were able to kind of talk about some of the challenges that they were having, the real challenges they were having to access and and getting services and having access to the programs that they needed for their constituency groups. So that's the first thing, is people really wanted to have the conversation. And then two, what we're finding is that just by casting the net out and saying to people, be a part of this conversation, that we're normalizing the mental health discussion through the outreach in a lot of ways. By putting it out there, people had to think about it, struggle with it, think about what we're doing well, what we're not doing well. One example, a really great example, is that for the young people, they were able to really think through what mental health means for them, right? And so they actually, as a result of their outreach and their peer-to-peer outreach work, they came back and said, hey, you know, we may need some resources. We may need some support as we are learning more about our own mental health. So, you know, we just thought that was fantastic. And again, another reason for folks to really think about having this conversation in the way that it makes sense in your communities, because it will help turn the dial. And with that, I'll hand off to Wendy, who will ask our next poll question about societal discrimination against those with mental health challenges.
Okay, thanks, Elaine, and welcome everyone again to the next poll question, poll number 2. Here we're asking, do you believe society discriminates against people who have a mental illness? So if you could click the appropriate box and let us know what you think, and of course this is your own opinion. So it looks like folks are kind of answering the poll. We'll give it another couple seconds for folks to click in and give us their answer. Once again, do you believe that society discriminates against individuals who have mental illnesses? Okay, it looks like we've got a fair amount of people saying they agree or strongly agree, and a couple of folks say that they don't necessarily agree with that, but it looks like a majority of people represented in this poll agree or strongly agree that society does discriminate in some element against individuals with a mental illness. So let's go on from here and listen more to what Tom and Elaine have to say and lead us through the rest of the webinar.
So obviously, based on the last poll, discrimination is a real issue. We know what the problems are. We know that barriers do exist, right? So changing the reaction to mental health and mental illness so that it is recognized and normalized and people feel comfortable seeking treatment. You know, that's kind of what we're trying to move towards. And then acknowledging the barriers and taboos in cultural communities. That was very relevant for Sacramento, you know, as we help to kind of get people to the resources that they need. I'm now going to pass it over to Tom, who's going to take us through Sacramento's action planning and talk about some of the creative problem solving that our group has done and has worked to kind of address some of these complex issues and barriers. So, Tom?
Thanks, Elaine. I think it's really wonderful to be with all of you today, and you know, to have somebody like Elaine who is very invested in that community. We really couldn't have done it without her. She has really great connections through all the various cultural communities, and I thought we were very successful as a result of her work. I did want to mention on the question on the demographics, one point that did come up. We found, I think it was like almost 65, 35 more women than men attended the event. So that was probably, of all the diversity and the questions and representative sample we had, that was the one issue, and I found that otherwise maybe women are more interested in this issue, but we certainly didn't have that issue with youth. So I wanted to just quickly run through what we did during the day of dialogue. Carolyn mentioned the 4 sessions that we work on. We did this over a 6-hour day. I want to look a little bit at the challenges and barriers and then look at what the needs are for youth in 2 age bands, 12 to 17, and transition age youth, which we call the TAY youth, 18 to 24, and what we did with the action planning process. So after you had this discussion about the importance of mental health to you and your community, we gave a set of challenges that people discussed. So we kind of group those into 3 areas. Some of the challenges are in your attitudes and beliefs. And I think this was actually the most significant area where people felt that our attitudes and beliefs really prevent people from seeking treatment. I know in Sacramento, and probably as in many areas of the country, there's a huge treatment gap. People do not seek treatment, partly because of attitudes and beliefs. Some of it's access to services and affordability, but clearly our attitudes and beliefs affect how well people seek treatment. And an interesting point that came up, stigma was often the #1 issue, but for youth, the 30% in the room, bullying was more significant than stigma, and maybe that's because stigma is more of an adult word, but bullying was very significant in preventing people from seeking treatment, as well as sexual orientation, some of the cultural bias and language barriers. Obviously, some of the serious mental health issues are significant, whether they be able to seek mental health treatment. Substance abuse, trauma is a much more significant issue in the last few years, and suicide's always been fairly difficult to treat and has been very consistent in its rates and prevalence. But we also looked at the underlying problems, and people certainly saw that being low income and in poverty, being homeless is a problem, as well as the tie-in to criminal justice system and in the jails. So obviously getting a job is a very significant issue. Being able to have the income to seek treatment were very important. So in our discussions, and these were 35, 40-minute conversations, these were the recommendations that came up from 350 people in Sacramento. They wanted more peer support groups and safe places to explore the mental health issues. And as Elaine said, having somebody that's a trusted advisor, somebody that you can go to, was very significant in some of the theming work that people had. Being able to have after-school activities with positive youth development, some better role models, not just people that are having problems, but people that can really demonstrate the ways in which we can be positive in our life and be able to be successful. And as you know, after-school drop-in programs are very significant. Social media campaigns, and I'll go through how this is translating into our action plan. They wanted more clinically trained professionals in the schools and helping to train teachers on what to look for in terms of signs and symptoms and early identification. They actually wanted more mental health in the curriculum, so let's just not have a health class, but be able to think about ways that we could actually bring the conversation into the curriculum, which I thought was pretty interesting. That trusted place to go, we've explored, like the health center in a school may need to be broadened to have counselors there, but not to make it to go to the mental health counselor. Make it a job counseling center, a program where people feel like they're not just going in for an issue. And workforce training and transition support was not only significant here, but in the 18 to 24 age band, which I'll go to next. So the transition age youth is significant because this is when they age out of some of the Medicaid services, Medi-Cal in California. They often fall through the cracks. They have more difficult issues in getting support services. So being able to have access to services and health insurance for this age group was really significant. They wanted more, service navigators have become a topic at a program that's coming through the Affordable Care Act and somewhat through the disability programs, but having services that can help really refer an individual so that there is a better handoff between the child and adult systems. The need for mobile crisis services and being able to do that in places where they do find themselves, whether within the jail system, within some of the homelessness in some of the areas that they are struggling to survive. A link to more career counseling, job placement, and internships. We brought the workforce investment program more directly into this. And again, with this group, the mentoring and peer support group. So being able to get access to job opportunities and internships and that fundamental independence and support is really critical for this age band. So I wanted to just give you, and I think Wendy will do this, a poll question that I think is significant.
Okay, everyone, welcome back for a poll question that's going to test your knowledge about mental health problems and when they present themselves. What % of adult mental health problems begin before the age of 14? Is it 15%, 25%, 50%, or 65%? And let's see, it looks like folks are voting, and we may be getting 50%, 65% as the top two answers. I'll give you just another second. Anyone, any last votes? Okay, so it looks like about 20% of you got the answer correct. It's 25%. So about 1/4 of mental health problems present themselves before the age of 14. And for this fact, along with other facts you can use to help build knowledge about mental health, you can go to the information brief, which is part of the toolkit, and it'll give you a lot of statistics like these, as well as the references to reference the research that supports them. Okay, and now we'll for the remediation.
So I know we don't have a lot of time left, and I'll run through these fairly fast. I wanted to give you, these are the action plan strategies. I gave you the recommendations that came from the day of dialogue for the 2 age bands. And now you have the full action plan is listed in the files there in the upper corner. So if you want to read the full plan, feel free to look into it. And obviously, this is Sacramento-based, and we have really the benefit of the foundations who really believe in the relationship between mental health and healthcare. And so they're willing to support us in the process to carry these action plan strategies forward. So I'm going to go through these one by one, looking at leadership and support for mental health, making sure we continue this conversation. It's not just that you can have a conversation on one day and think that you've really gotten very far on it. Building a broad-based effort to identify the early signs and symptoms, building the youth into a social media campaign to address mental health issues, very significant issue of integrating behavioral and mental health services much more into primary healthcare services, the navigational system for accessing services, making that up to date, building a system of care. You know, there's many systems of care out there for children kind of 0 to 18 and sometimes up to 21, but a more specific one for transition age youth, and then ensuring all of our services meet the standards, especially in Sacramento, for cultural and language competencies. So, you know, this is stuff that I think is important to think about. If you're going to do a discussion, then what? What are we going to do once we come up with some action planning strategies? And for Sacramento and California, Senator Darrell Steinberg was kind of the father of Proposition 63, very significant actor in creating additional resources for mental health. But I think the important point for us was that this conversation needs to continue, and we need leadership in the community. It's not just leadership for those that have the services and the mental health and drug and alcohol boards. It really needs to broaden into the corporations and the county leadership that's there. So we have a request for proposal to put out for organizations that will then support the leadership of the plan, and our executive committee will continue on to manage the process going forward. We had a full hour dialogue tape that was done by the public access station in Sacramento. So we have created this program so it can be done on TV and online, and we're using that then in some of the curricula within the schools to continue this conversation. Then you can link those kinds of conversations that would occur throughout the community in Sacramento to the Creating Community Solutions team. And one of the great things about the national effort here is we can really compare some of the outcomes from what's occurring in various communities and learn from each other. I just finished a big one October 12th in DC, and there's a lot of commonalities, but there's things that we need to think about and how we can do this better, especially like through social media. Significant across all of our program was how can we train various professionals, even working with youth themselves, to create a better identification of the signs and symptoms of mental health challenges. And while the serious emotionally disturbed children and youth may have more access to mental health programs, it's really those 20% that may have signs and symptoms but need access to services. So we're working on, Youth Mental Health First Aid is a great program, as a good starting point, and we're working on all the different efforts that are out there, whether it be on bullying or violence reduction, suicide prevention. How do we create a more integrated campaign for accessing services and using the broad base of mental and behavioral health to create a broad-based early identification program? I just want to mention this too because Elaine said it as well. There's a lot of interest in working with crossover youth, those who are involved in both welfare and the juvenile justice systems with wraparound services. A key component of that has been trauma-informed care systems and working on how do we really deal with some of the signs and symptoms of those that have really had trauma in their lives. How do we build better qualified programs that are informed on how to provide care for youth that have trauma? It's a very significant issue in both Sacramento and in Washington, D.C. As we've mentioned, we are moving forward on creating a better social media platform that is designed by youth. So they'll be moving forward on looking at how do we create some positive messages, how do we get access to services, and really provide some strong youth leadership in these efforts. I think I was very impressed by how this galvanized a broad base of the youth in looking at these issues, not just sort of on the broader question of mental health, but how do we then take some action and create access to services. The large issue that I think is kind of hanging around in the mental health world, behavioral health world, is that we really need to look at how do we create greater integration with the primary care clinics, the schools, the pediatricians, so that they can know that they can identify these signs and symptoms and have a place to refer. So we're working very closely with the healthcare providers. The Affordable Care Act brings in some new access to mental health services. So once those services are better be able to be accessed, we want to make sure that the primary care clinics and pediatricians know how to diagnose and refer. As I mentioned, the Service Navigator system, we want to tailor that much more specifically to the kinds of programs in our community. Also look for how do we create a toolkit, an online guide for accessing those services that can be up to date. The transition age youth, as I've mentioned a little bit about, but there are various counties and places around the country that are doing an excellent job of specifically providing services. So our recommendation, our action step here is that we really need to think about how we create a system of care for transition age youth, integrating behavioral health, looking at early identification of mental health needs. I think very specifically the employment services sector is one that we want to work much more directly with and to help them understand signs and symptoms and the ability to address mental health issues. And finally, as certainly important in Sacramento, being able to review how all these programs, are they not only providing sort of materials, but being able to have access to translators, being able to think about some of the cultural taboos and issues when they don't have a definition for mental health, and be able to provide some really good culturally relevant programs to meet the need locally. So I think that
Tom, you went
I can now help, and both Elaine and I can maybe address questions for a few minutes. I know we don't have a lot of time.
Yep, exactly. So we'll review a couple of questions that have already been asked, and then let folks know that they can also ask additional questions if you need to. So for the first question, I think we had a question earlier about how the state mental health organizations have been involved in any of this effort. And I can actually answer that question, so I'll go ahead and do it very quickly. We have not directly reached out for every single community event to the state mental health organization. Some of them have found the events on the website. We also have NASHBID as a partner. So we've reached out to many states through NASHBID to make sure that they know what's going on in their states, and also Sue and another colleague of ours, Mary Jackstite, will help facilitate some of those connections for folks who are planning community conversations. So if you have a community event and you would like to partner with your state mental health organization, get in touch with Creating Community Solutions, and they, as well as I, will help you contact your state folks to get them engaged in your efforts as well. Okay, so the next question, this is for Tom and Elaine. They had a question about the number of youth who were included in the effort, and they weren't sure, I think, about the age group. So could you just give a quick description of what youth were participating in Sacramento and how old they were?
Elaine, I'm looking to you on this one.
Sorry about that. I was speaking and I was on mute. So we had over 100 young people. What I can do is I was trying to gather the exact numbers, but in terms of the percentages, we had 17% of the people in the room were between the ages of 14 and 18, and 13% were between the ages of 19 and 24.
Okay, great. And I think the question was asked in terms of how many people were surveyed, and I just wanted to clarify that those were the participants in the actual event in Sacramento who were surveyed on-site during the event. Okay, the next question we had in the chat, which I answered already, is how is this going to be paid for? Some of those details Carolyn gave earlier in the presentation, but Carolyn, do you have any other thoughts about how communities can fund these kinds of activities?
That's a great question, and I'm sure all of you know that this is, I'm surprised in doing this work about how difficult funding for mental health work is. Here's what we've found is most possible. Community foundations very often have closer to the ground understanding of these kinds of issues than do other kinds of foundations. There are a small number of communities in the country that are fortunate to have an actual foundation who's dedicated to mental health. I think of one in Akron, Ohio called the Margaret something Clark Foundation, and that's all they do is fund mental health. So I think the first thing to do is, go to your website and look at the listing of foundations in your area and what their specific topics are. The other area that we have found really very valuable is many families who've dealt with this sort of affliction in a serious way, who are on the affluent at least enough to be middle class or upper middle class or higher net worth, very often appreciate and understand the challenges that the whole community faces, not just their family. So identifying a family like that has been very, very helpful in many communities. Scattergood Foundation is another one in Philadelphia where that is their primary mission. There are a few jurisdictions where the politicians in sitting elected offices understand that these challenges are very significant and have, even in these hard, scarce times, committed to actually provide some funding. We think that will happen in Ohio. We're pretty confident it will happen in Colorado. So taking a good look at who the mayor is, what the council is, if you're dealing with this in a city level, or as in most states, whatever federal funds are coming into a state come in through the county commissioners. So most of the lead cities have involved the executive director of the county commissioners as well as the other folks that we were talking about. Frankly, another source, and you can quickly learn this from your Department of Mental Health, the country's social services in mental health mainly come in through private sector behavioral health companies, and they service different geographies across the nation. So Providence Health, for example, has a big interest in Washington, D.C., and we're helpful. Centum is another company that came up with some funds for some of our work. So do a scan of what are the behavioral health companies that are selling insurance policies in your state and find the right person, 6 degrees of separation, to talk with them.
And I also wanted to give another example of a mental health organization who's really helped us, a foundation that we didn't know about until the National Dialogue came up, called the Foundation for Excellence in Mental Health out of Oregon. They've been a fantastic partner through this whole process, and so we're really thankful for their efforts as well.
I realize all of us spend so much time concerned about actual physical resources that I also want to say that many of the 66 smaller conversations that are on the web have done their entire work by in-kind contributions from organizations. The library is providing the space, or the church providing a space, a PTA providing food and drink for a shorter conversation. So in a way, you may be more interested in looking at what's the combination of partners that could give you in-kind support rather than thinking about having to create actual dollars to pay for it.
Great, and it looks like we don't have any other questions in the chat box, and we're getting ready to wrap up, so I just wanted to give a couple of announcements as we wait for any. Oh, go ahead, Carolyn.
You know, I actually was looking back again at the frequently asked questions about Text, Talk, and Act, and this question came up earlier, but that platform is going to stay live for a whole month after December 5th. So as you're thinking about a network or list that you are interested in and you believe that 48 hours is too short a notice, it's entirely possible to actually participate by going onto the platform after the 5th. And as Wendy already said, and all that means, all you have to do to get to that platform is texting the number that is in the slides to begin with. And as Wendy said, if this is as successful as we believe it is, we'll be repeating it again in the spring.
Yeah, so we'd really appreciate your feedback and engagement to let us know how you would like to participate, if possible, in the future. First of all, I wanted to thank all of our speakers on today's webinar, Tom and Elaine and Carolyn. We just thank you so much for all the work that you're doing. Thank you for the folks that you represent in the communities and in the organizations who've been our partners through this whole process. We're very helpful, are very happy that the Office of Juvenile Justice Programs has asked us to collaborate in this way. And I just wanted to mention also that we've been collaborating across the federal agencies on this particular initiative. So we've worked with the White House, with Department of Ed, with CDC, as well as the National Institute on Mental Health. So we have a lot of federal partners and federal resources invested in this as well. And so we encourage you to contact us if you'd like to get involved, and we'll be happy to connect you with the right partners. Also, just on behalf of SAMHSA and OJJDP, thank you for joining our webinar, and we hope that you'll share this information with your professional networks, with your friends, and with your communities. Please share the information about Text, Talk, and Act widely, and also the toolkit as well. And we hope that you'll share the web resources and the websites as well. So mentalhealth.gov, creatingcommunitysolutions.org, and samhsa.gov. I wanted to just do a quick reminder for Text, Talk, and Act. We also will use the hashtag Text, Talk, Act on social media, so on Twitter. If you want to know what is going on the 5th, you can also log on to Twitter and search hashtag Text, Talk, Act, and you'll be able to follow the conversation and people engaging on social media. Okay, and now lastly, if you could, before you click off of this webinar, go ahead and take a quick evaluation and just let us know how we did and give us any other feedback or thoughts that you may have. Thank you so much for your participation. Have a wonderful day.